Tonight, the CDC has a lot more open positions to fill because in the midst of a bizarre back and forth that happened over the last 24 hours about whether or not the CDC director was or was not fired, resignation letters started piling up from some of those senior people who are responsible for shaping public health. Three of those public health leaders are my sources tonight. They've all spent years guiding the country's response to disease outbreaks and building the framework designed to keep Americans healthy and alive. Dr. Deb Howry was the agency's deputy director and chief medical officer. And more than a decade at the CDC, she briefed the public on everything from diabetes rates to mental illness among children to opioid prescribing recommendations. She joined the agency in 2014 to lead the National Center for Injury Prevention and Control, which dealt with issues like gun violence and suicide. In her resignation letter, she wrote, "Recently, the overstating of risks and the rise of misinformation has cost lives, as demonstrated by the highest number of U.S. measles cases in 30 years and the violent attack on our agency." Dr. Dimitri Daskalakis is an infectious diseases physician, and as the director of the National Center for Immunization and Respiratory Diseases, he ran the team that issues vaccine recommendations. He joined the CDC in 2020 to direct its HIV prevention division, and he spent a year deployed to the White House working to help coordinate the country's response to Mpox. He now says he's, quote, unable to serve in an environment that treats the CDC as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than to improve the public's health. Dr. Daniel Jernigan is a top flu specialist and was the director of the National Center for Emerging and Zoonotic Infectious Diseases, meaning he was in charge of the team that is tasked with preventing you from contracting diseases like rabies and smallpox. He worked at the CDC for 30 years, leading key responses to anthrax and Ebola. In his resignation letter, he focused on the disease's significant impact, mitigating illness, preventing deaths, and improving the lives of millions of people. And I'm so grateful that you're all joining me here tonight. I can only imagine what the last 24 hours have been like. And Dr. Daskalakis, I just want to start with you because to see the video of when y'all exited the CDC today and all of your colleagues were outside, I imagine was an emotional moment. And I just wonder what it felt like to leave the CDC under these conditions today.
I think Dr. Howry and her comments really captured it. It was, very bittersweet. I love public health and I love CDC. And so, I was really, interested in having a long career there. And, that wasn't in the cards. But what was in the cards was that I got to meet amazing scientists and amazing leaders in public health. And what I thought as I was walking out and what I said when I was walking out was, that's what makes CDC. Those people are what makes CDC. And, we've been through a lot. There's been dehumanization of people who work in public health, and seeing the humanity. America needs to see that those are the people who are with love protecting their health and the security of the country.
Dr. Howry, just given what triggered all of this, the ouster of the CDC director after just a few weeks of Dr. Monarez being on the job, you're the chief medical officer. Had you ever talked to her about resigning? Was it clear that there was tension between her and Secretary Kennedy?
So I had talked with her just around, some of her recent conversations with the secretary, but she was very committed to the CDC and wanted to stay. I think that's just how we all felt, initially. We want to stay, we believe in the mission, but when you can't make things work, sometimes leaving is the statement to make.
And have you spoken to her since she resigned?
I have. I spoke with her yesterday, and she just, gave her support to Dimitri, Dan, and I. She wanted to give all the CDC staff big hugs and wants us all to continue fighting for public health in whatever position we can.
Dr. Jernigan, when you look at this situation, she was the first permanent director that the CDC had in months. Yes, there is an acting director that the White House just named a couple of hours ago, but is it clear who is calling the shots and actually running the CDC?
Yeah, that's a great question. And I think, you know, I've been at CDC for 30 years. I've been through multiple different administrations. We've been able to work with a lot of different folks, different ideologies, but we always focused on the science. Right now, I'm not sure. As uh, Dr. Benares has had to step aside, I don't know who actually will be making those calls, but I do understand that when we've been working on these data that we make decisions from, a lot of that is coming from the White House, is coming from the HHS, and so I don't know exactly where we're going to go next, but I do know that the CDC has a mission to protect Americans, and that's something that I will always work to make sure that we're doing.
Is it alarming to you, Dr. Jernigan, to hear that, or to kind of reconcile the fact that it's not clear who is calling the shots?
I think it's unfortunate. I think you want a director that has the power to make decisions, to use science to make sure that those decisions are leading to appropriate policies. And right now, I can't tell if if we have that currently in place right now.
Dr. Daskalakis, we heard from Secretary Kennedy today, actually. I should just remind people there was a back and forth last night over whether or not the CDC director had been fired. She basically said she hadn't heard from the White House. Then the White House came out and issued a statement saying that yes, she was being fired. This is what Secretary Kennedy said today about the state of the CDC.
The CDC is an agency that is very troubled for a very long time, and anybody who lived through the COVID pandemic and saw all of these bizarre recommendations that were not science-based, all the misinformation, there's a lot of trouble at CDC, and it's going to require getting rid of some people over the long term in order for us to change the institutional culture and bring back pride and self-esteem and make that agency the stellar agency that it's always been.
Dr. Daskalakis, is that what the CDC needs in your view, an overhaul?
I think the CDC really is a place filled with great scientists and experts. And I think that if CDC is being characterized as troubled by Secretary Kennedy, I think we have to turn the mirror back to him, because I think that the trouble is emanating mainly from him. I think that the disregard for experts, the clear statement that experts should not be trusted, really makes it seem unlikely that his mission for CDC is to be a bastion of scientific expertise. Additionally, I think that his reaction to what happened when we were attacked really traumatized an already traumatized organization. So I don't think I want to call it troubled. I think that CDC has made such progress in transforming itself after the pandemic, and that progress is being dismantled by Secretary Kennedy and his I don't know what his vision would be. I guess you'd call it vision for public health, but it's not been articulated, so I can't tell you what that vision is.
Yeah, and you're talking about the shooting that happened. The White House was actually asked today, why President Trump hasn't commented on that. And Dr. Howery, I see you shaking your head. Some people might listen to what Secretary Kennedy said there and say, well, the CDC did make mistakes during COVID, and maybe he has a point. I wonder what you would say to someone who his comments there might have resonated with them a little bit.
Well, I want to point out that, COVID began 5 years ago, and certainly CDC made mistakes and learned a lot from them, as did other federal agencies. But what I can tell you is CDC made significant strides in the past few years, really, in the past few, to where our data are now extremely timely, I mentioned this in my letter, near real time dashboards that the public can use. Our publications are coming out within a week of an outbreak. I look across the centers and they're much more interdisciplinary. We are response ready. What has happened, though, is in the past year was staffing cuts, with plans for reorganization. All of this is being dismantled. So if we want to say that the CDC needs an overhaul, it's because of what has happened in the past few months to it, not because of COVID. We've made tremendous progress since COVID that we were all really proud of, and the state of the agency and the innovation that we were putting forward at the time.
Dr. Jernigan, when you look at as someone with so much experience as the three of you have, but also you at the CDC and in this area, I imagine it was pretty hard for you to resign.
Yeah, I have been at the agency for over 30 years, and the people that I work with are some of the smartest people I know. They are extremely driven. They have done things that are incredible for protecting Americans. And in that sense, it was very difficult for me to make that decision. But when I find that the thing that has been the focus of CDC, and that is using science to drive policy, to make the right decisions, when we're not able to do that, then I was not able to do the job that I was there to complete. And so for me, it was best to resign.
Dr. Daskalakis, I see you shaking your head as well. Do you believe that anyone from, or did you ever experience anyone from Secretary Kennedy's office interfering with the work of the CDC?
I think that there is public evidence of the intent to interfere with the science at CDC. I think Dr. Jernigan can speak to that in detail. So can Deb Bowery. But I think that most recently, the release of the documents that help form one of the ACIP work groups on COVID-19 really demonstrate where interference will be coming. And so very specifically, this document that puts together the work group that provides inputs to the Advisory Committee on Immunization Practices states that that the chair of the work group, who is a staunch opponent to COVID-19 vaccine, who on his Twitter has a pinned tweet that says that no one should ever get the COVID vaccine and it should be banned, is now the head of that and has been given authority to guide CDC's science. And additionally, that document says that his role is to make sure that CDC bias does not permeate the work group. CDC does not have bias. On the contrary, the people that have been installed by Secretary Kennedy are full of ideology and bias that will actually contaminate the science. So I think that we have evidence that this is coming. And I think that the other part that we're seeing is that decisions are being made and data is being retrofitted to be able to address the decision. I think that is really a clear sign that the direction that the country's public health is going is not one that is evidence-based or science-based, which is why our resignations are really together are trying to raise a red flag for everyone.
Dr. Howery, I mean, can people trust what is coming out of the CDC in your view?
What I can tell you is the publications like the MMWRs and the data dashboards, I personally cleared, as did, Dimitri and Dan. So those that come from CDC we saw some things that referenced CDC before, like a fact sheet on some of the COVID vaccine recommendations that was around HHS. We had never cleared that, and that had, factually inaccurate information. It mentioned CDC, but it didn't come from CDC. If it's coming from CDC scientists, you can trust it. If it's coming from the administration and hasn't been cleared by CDC scientists or reviewed by it, then I would have concerns.
Yeah, but how do people know? I think that's the question is, if that's the case now, is that the case going forward? Or how do regular, normal people distinguish that?
And I think that'll be the concern. And I think what I also find concerning is just how President or Secretary Kennedy, will misspeak on things, and when we talk about things like, vaccines and vitamins in the middle of the measles outbreak, he will push vitamins, as prevention versus, it can be an adjunct. And so I think it's really, we included stuff on vitamins on our information on measles, but we want to be very clear. Prevention via vaccines was the most important thing. The secretary then might speak about it and elevate different things, which makes it difficult when he takes our materials and uses his own personal spin on it.
Dr. Jernigan, when you look at this, we're hearing from senators on this, particularly Senator Bill Cassidy, who everyone was watching very closely during Secretary Kennedy's confirmation hearing. He's saying these departures will require oversight by his committee, and Secretary Kennedy is actually scheduled to testify before Senate Finance on September 4th. That was before all of this happened. What do you want Senate Republicans to ask him?
Well, I think the Senate Republicans have been behind the nomination and the approval of Dr. Menorahs. She had as her focus to work on science, to have science as the primary means for making policies. I would love for those folks to be asking him, what is his priority? What is it that he wants to help the American, how does he want to help the American people? Is he going to be following the science? Will he stick to what he said earlier about vaccines? We want to make sure that he supports the use of vaccines. We want to know that he is using science in helping to make those decisions. But at this point, we have been working with the administration, providing data. We don't know exactly what the processes they're using with that science. We don't know exactly how they're approaching it. And so if there is going to be some new findings that are released, we are not sure if those are going to be supportive of vaccines and of scientific approach.
Dr. Daskalakis, you were specifically referenced today during the White House press briefing. I'm not sure if you saw this, but I want everyone to listen to what the press secretary had to say today.
One of those individuals wrote in his departure statement that he identifies pregnant women as pregnant people. So that's not someone who we want in this administration anyway.
I want to give you the chance to respond to that.
Yeah. No, I think that, well, first I want to say one thing in response to something Dan said. So I think that an important thing to ask the secretary is, has he been ever briefed by a CDC expert on anything, specifically measles, COVID-19, flu? I think that people should ask him that in that hearing.
What would the answer
That's
to
number
that
one.
be?
So the answer is no. So no one from my center has ever briefed him on any of those topics.
Really?
So I don't know where he's getting his, really.
No one has ever briefed him
back to
on any of those issues that you just mentioned there, including measles, given the outbreak in the United States right now?
He's getting information from somewhere. Yeah, he's getting information from somewhere, but that information is not coming from CDC experts, who really are the world's experts in this area. Like, folks from around the world call us with questions around these infections. And we are seen as the expert. CDC is seen as the expert in these areas. CDC is the preeminent public health organization, I'm going to say, in the world. And he's not taking us up on several offers to brief him on these very important topics.
Why do you think
Now,
that is?
On the issue, I don't know the answer. Perhaps he has alternate experts that he may trust more than the experts at CDC that the rest of the world regards as the best scientists in the areas. But back to the question, I have for my entire career been an advocate for the LGBTQ community through my work in HIV, through my work in MPOX. I find it outrageous that this administration is trying to erase transgender people. I very specifically used the term pregnant people and very specifically added my pronouns at the end of my resignation letter to make the point that I am defying this terrible strategy at trying to erase people and not allowing them to express their identities. So I accept the note from the press secretary and counter that with, I don't care.
Dr. Dimitri Daskalakis, Dr. Deb Howery, and Dr. Daniel Jernigan, I really do appreciate you coming on to share this after you took this step of resigning today and protest, and appreciate you sharing this with us tonight. Thank you.
Thank you.
Thanks.
Thanks for having us.